All right. Hi, Ben. My name is Miriam. I'm the student physical therapist assistant with Owens Community College. I'll be working with you today.
Hello.
Can I get your name and date of birth just to confirm?
Ben, July 10th, 1999.
Perfect. And then I see that you have had a pretty rocky past with some drug use, and then recently you just had heart surgery. Is that correct?
Yes.
Awesome. And then I think just a combo of both those events kind of led you to having a stroke affecting your right side, and just that trauma in your brain kind of left you with some slurred speech, and then also some impaired coordination, and then also a weaker right upper extremity or arm. So how are you feeling today with all that considered?
I'm feeling okay.
You're feeling okay? Okay, not too bad. So today we're going to throw some new interventions at you and some new transfers just to help progress you towards independence and then also getting you back to those normal activities of daily life. So first we want to really intentionally use that right arm. We don't want to have any issues of non-use to that right arm, and then also we want to improve our core strength as well, just to help you progress towards that independence and also feeling more able to get back to daily living. And we will also show your dad some gait training and walking with a cane that we've been working on as well. How does that sound?
Good.
Perfect. And then, do you have any questions before we get started? Great. Have you seen one of these before?
No.
Okay, this is a gait belt. It is just going to go around you during treatment just to ensure your safety, reduce that fall risk, so no unnecessary paperwork is needed. So, do you have any lines, tubes, or wounds around your stomach?
Nope, just my chest.
Just your chest. Okay, is it okay if I feel for your hip bones?
Yep.
Perfect. It's just going to go around your stomach here. We want it to feel snug, but not too tight. How does that feel?
Yep.
Good. Nice. Okay, so the very first intervention that we are going to do just to work on that right arm strength and also core strength is going to be grabbing this dog toy from one of my arms and then moving it, delivering it to the other arm. And really I want you to focus on squeezing those stomach muscles and then also just trying to move that right arm, not getting your whole body into the exercise. Also, we want good posture. We want to have our spine straight and our shoulders rolled back. We don't want any of this. Okay? Does that sound good?
Yep.
Any questions? Okay, perfect. So with your right arm, I want you to reach and grab this dog toy and then deliver it to my other arm. Nice. And then you can come back to resting and then again grab that dog toy and deliver it to this arm. Good. Come back to resting. One more time. Grab that dog toy and then deliver it to my other arm. Nicely done. Good. And that will just help to improve your strength as we move on to our next intervention. We are going to be moving you from this mat to this wheelchair that I'm sitting in. So this wheelchair is going to be positioned 45 degrees from the bed. Also, I'm going to lock the wheels and remove the armrests closer to the bed, as well as the legs, just so we don't have anything that we're going to trip over. So for this transfer, what we are going to do, we are going to kind of scoot you along and bring you closer to that wheelchair. So when we scoot you, I want you to think about bringing your butt off of the mat here.
So like push with my arms or just?
Yeah, you can push with your arms, and then we also, wait, this is your right side. We're going to move you to your affected side.
Okay.
So pretend that the chair is on the right side. Not pretend, the chair is on the right side. Nice. So moving you towards that right side is just going to again help with strengthening the affected side. So
Just push up and scoot.
yes, which I'll help you with it.
Oh, sorry.
No, you're good. So I want you to scoot forward just a little bit, making sure those feet are flat on the floor. Perfect. And then we are going to lean so your nose are coming over your toes, and then scooting that butt up. And just scoot in and move. Once again, scoot and move. And now go into the wheelchair. 1, 2, 3. Nicely done. How are you feeling? Good. Okay, perfect. And if at any point during our interventions or for the transfers you begin to feel dizzy or lightheaded, let me know and we will stop.
Okay.
So, last but not least, we have our our cane here that we are going to be just showing your dad how to best guard you when walking with a cane. So, on our good side, which is our left side, we're going to have that cane stepping, followed by our right leg, left leg. Cane, right leg, left leg. And then also with that, we want to just work on some coordination of our right arm, trying to get it into a regular swing when walking. How does that sound?
Good.
Good. I'll give this to you. And then also, just for some tips for Ben, we want you to be positioned on your son's injured side. I think I just called the dad Ben. The dad of Ben. I want you to be positioned on Ben's affected side just to reduce that fall risk again. And you can stand slightly behind him as well. So just to demonstrate what this would look like, I'm going to have you scoot to the edge of that wheelchair and we'll stand you on up. Think nose over toes. We're going to stand 1, 2, 3. Perfect. So I want you to be positioned behind his right side like so, and when he begins to take that step, you can step with the cane, right leg, left leg, perfect. You are guarding him like so, just to reduce that fall risk. Nice. And thank you, Ben, so much for your time, and as well as Ben's dad. I hope you guys have a good rest of your day.